Here's 5 blood tests to get done if you're over the age of 40 and approaching perimenopause. Unfortunately, your doctors probably won't run them, but they are super important to get done, especially the last one. Number 1 is going to be a full thyroid panel. Your TSH, your T3 free and total, your T4 free and total, your reverse T3, your thyroglobulin antibody, and your thyroid peroxidase antibodies are ones you need to get done. Most of the time, people only get their TSH, and if they're lucky, a T4 free marker ran. But if you want to see a full assessment of the thyroid, you need to get all these markers done. Number 2 can be inflammatory markers. Things like your homocysteine, which is very important for methylation activity. When it gets too high, can really mess with someone's mood in particular, but also is an increased risk for cardiovascular concerns. But also things like your C-reactive protein, which is a general inflammatory marker that when it gets too high is also associated with cardiovascular concerns, but also can impact and is associated with joint pain, fatigue, and other concerns as well. Number 3 is going to be some blood hormones. There's going to be a lot of changes that are occurring, so making sure you have a good status and understanding of where your hormones are at is going to be very important. So things like your progesterone, your estradiol, your testosterone, your pregnenolone are all going to be very important to make sure you understand where your body's at. Number 4 is going to be an anemia panel, but in particular, you want to see where your ferritin is. This is your iron storage. Now, when this gets too low, a lot of symptoms of fatigue, brain fog, hair thinning can occur, which can really impact your thyroid and other systems of the body. On the flip side, however, if ferritin gets too high, that can cause a lot of liver stress and also give me an indication of any inflammation or infections that might be present. And number 5 is going to be your fasting insulin, not just your fasting glucose. Your insulin is very important because it regulates your blood sugar. And if you don't know where it's at, it can be associated with weight gain, especially that belly fat. It can be associated with sugar cravings, those energy crashes throughout the day. And many women around this time, one of the number 1 reported symptoms is weight gain. If you've been told that your labs are normal, but you still don't feel normal, you're probably missing pieces to the puzzle. So get these 5 labs done right away. If you want the most common blood panel that we run in the markers, go ahead and comment blood work down below.